Good morning. I'm Paul Summergrad, President-elect of the American Psychiatric Association, and I'm also the Chairman of the Department of Psychiatry at Tufts University School of Medicine and Tufts Medical Center in Boston. I'm going to become President of the American Psychiatric Association in just a few days. The American Psychiatric Association, as many of you may know, is the oldest medical specialty organization in the United States, and there are many, many issues coming up right now facing mental health and mental illness care in the United States. Among these are advocacy for patients so that there's fairness and equity and justice, the implementation of the final rule for parity, and also the Affordable Care Act are both extremely important elements which will expand the availability of mental health and substance use services to large populations. Secondly, under healthcare reform, there's tremendous interest in the integration of care, not just in psychiatry, but patient-centered medical homes, and the development of new and alternative models of providing care that really integrate general medical care and specialty care, including psychiatric care and substance use services. So with all of those work together, we think it's an extremely important time for psychiatrists, for other mental health providers, but also for other general physicians as well as psychiatric physicians to be focused intensely on what we can do to really improve the patient experience and quality of care. We know that there's an enormous amount of medical and psychiatric comorbidity, which has not just impact on suffering and early morbidity and mortality for patients, but also the cost of care. So we have done a lot of work with the American Psychiatric Association to focus on ways in which those kinds of care models can be further developed and implemented. In addition, we're at an extraordinary period in the history of neuroscience research, genetic research, and we're really beginning to finally get to some of the most fundamental understandings of how the brain is beginning to the brain operates. We're just beginning to get that understanding. Those neural circuits that are associated with significant psychiatric symptoms or illnesses, and also the genetic environmental interactions, both with the brain and with the genome itself, that affect the onset and development of psychiatric illnesses. I think one of the other things that's really important and is part of our advocacy work is to help people understand that psychiatric illnesses are really the preeminent disorders of young people. 75% of psychiatric illnesses begin before the age of 30, and they have long-term consequences both in terms of disability and morbidity and mortality. So those are very important factors as well. In addition, we're working with other groups, both general medical groups and other groups within the mental health environment to help make sure that there's appropriate advocacy for all the things that we've talked about: access to services, care, and research. So we think that this is a moment of incredibly important opportunity around mental health. As many of you know, there have been several bills now introduced into Congress looking at improving the mental health care system, and we think that this is a moment in time when it's critical that we focus on both the research, the science, the clinical delivery system, and the equity and parity that patients need for psychiatric care. In addition, we're working with partners throughout academic departments, our membership, other organizations, and partners throughout the world. So we're working with other organizations, both nationally and internationally, to look at the very significant issues related to global mental health. There's just a burgeoning recognition right now that there is tremendous impact, both in terms of health, well-being, suffering, and morbidity and mortality in regard to global mental health issues. But internationally, the stigma associated with psychiatric illness is even greater than it is in the United States. So this is something that's going to require multiple organizations working together, including foundation support, to really reverse a long-standing neglect of these issues internationally. But it's taken together both at the national and international level. I think it's becoming clear that mental health and mental illness issues are things that are simply too large to ignore. And if we're really going to do the kind of things we need to do, both in terms of healthcare reform and reducing human suffering, we really have to pay better attention to mental health. And those are all priorities for the American Psychiatric Association now and going forward.